Scabies is an infestation of the skin by the human itch mite, which is called mite Sarcoptes scabiei. This mite lives and lays its eggs in the skin. The most common signs and symptoms of scabies are intense itching, which is called pruritus, especially at night. Pimple-like itchy rash on the skin, which is called papules. The rash also can include tiny blisters, which is called vesicles, and scales. Tiny burrows, small holes, can be seen on the skin. These are caused by the female scabies mite tunneling the surface of the skin. These burrows appear as tiny raised and crooked, grayish-white lines on the skin surface. Because mites are often few in number, only 10 to 15 mites per person, these burrows may be difficult to find. They are found most often between the fingers, in the skin folds on the wrist, elbow or knee, and on the penis, breast, or shoulder blades. Itching and other symptoms can be present across most of the body or just certain areas such as the wrists, between fingers, or along the waistline. The head may be affected, but this is typically only in young children. The scabies mite usually is spread by direct, prolonged, skin-to-skin contact with a person who has scabies. Scabies can spread rapidly under crowded conditions where close body and skin contact is frequent. Contact generally must be prolonged. A quick handshake or hug usually will not spread scabies. Scabies is spread easily to sexual partners and household members. Scabies sometimes is spread indirectly by sharing articles such as clothing, towels, or bedding used by an infested person. However, such indirect spread is less common. How soon after infestation do symptoms of scabies begin? If a person has never had scabies before, symptoms may take 4 to 8 weeks to develop. It is important to remember that an infested person can spread scabies during this time, even if he or she does not have symptoms yet. Crusted scabies is type of scabies. Crusted scabies is same diseases but affects the people who has weakened immune system, such as the elderly, disabled and people with HIV. Crusted scabies also called Norwegian scabies. Persons with crusted scabies may not show the usual signs and symptoms of scabies such as the characteristic rash or itching. People with crusted scabies exhibit scaly rashes, slight itching, and thick crusts of skin that contain large numbers of scabies mites. Large number of scabies mites and crusted skin is hallmark of crusted scabies. Crusted scabies spread much more easily because of high number of mites. And treatment is more difficult because crusted skin protects mites from topical creams. Treatment. Permethrin, a pyrethroid insecticide, is the most effective treatment for scabies. It is applied from the neck down, usually before sleep, and left on for about 8 to 14 hours, then washed off in the morning. Care should be taken to coat the entire skin surface, not just symptomatic areas. Options to control itchiness include antihistamines and prescription anti-inflammatory agents. Oral ivermectin is effective in eradicating scabies, often in a single dose. It is the treatment of choice for crusted scabies, and is sometimes prescribed in combination with a topical agent. Other treatments include lindane, benzyl benzoate, protamidin, malathion, and sulfur preparations. Anyone who is diagnosed with scabies, as well as his or her sexual partners and other contacts who have had prolonged skin-to-skin contact with the infested person, should be treated. Treatment is recommended for members of the same household as the person with scabies, particularly those persons who have had prolonged skin-to-skin contact with the infested person. All persons should be treated at the same time to prevent reinfestation. How can I remove scabies mites from my clothes? Scabies mites do not survive more than 2 to 3 days away from human skin. Items such as bedding, clothing, and towels used by a person with scabies can be decontaminated by machine washing in hot water and drying using the hot cycle or by dry cleaning. Items that cannot be washed or dry cleaned can be decontaminated by removing from any body contact for at least 72 hours. Itching may persist for several weeks after completion of treatment.